Hello, I am Dr. Z, a board-certified urologist. In my daily clinical practice, I treat men and women who are experiencing sexual health problems that significantly affect their quality of life, confidence, relationships, and emotional well-being. One of the most frequent and most distressing concerns I hear from patients is sexual dysfunction that begins after starting antidepressant medications. Antidepressants are essential, life-saving medications for many people. They are prescribed for depression, anxiety disorders, panic disorder, obsessive-compulsive disorder, post-traumatic stress disorder, and chronic pain conditions. However, despite their mental health benefits, these medications are also well known to interfere with sexual desire, arousal, performance, and satisfaction. Unfortunately, sexual side effects are often not discussed openly at the time antidepressants are prescribed. Many patients feel embarrassed, confused, or fearful when these symptoms appear. Some stop their medication suddenly without medical guidance, which can lead to serious mental health consequences. Others silently tolerate sexual dysfunction, believing it is something they must accept in order to remain emotionally stable. This document is designed to provide a clear, thorough, and medically accurate explanation of how antidepressants affect sexual function in both men and women, why these effects occur, and most importantly, what can be done to manage them safely and effectively. Sexual health and mental health are not opposing goals. With the right approach, most patients can achieve both. Why sexual health is a medical priority. Sexual health is a fundamental component of overall health and well-being. It plays a vital role in emotional connection, self-esteem, stress regulation, intimate relationships, and overall life satisfaction. When sexual function is disrupted, it often leads to frustration, shame, anxiety, and strain within relationships. For individuals already dealing with depression or anxiety, sexual dysfunction can significantly worsen psychological distress. Research consistently shows that sexual side effects are one of the leading reasons patients discontinue antidepressant treatment. This is concerning because untreated or poorly treated depression is associated with increased risk of relapse, impaired work and social functioning, and in severe cases, suicidal thoughts or behavior. From a medical perspective, sexual side effects should never be dismissed as trivial or unimportant. They directly influence treatment adherence and long-term mental health outcomes. As urologists and sexual medicine specialists, we view sexual dysfunction as a legitimate medical condition that deserves careful evaluation and evidence-based management. Addressing sexual side effects does not mean abandoning mental health treatment. Rather, it means optimizing treatment so that the patient can function well both mentally and sexually. It is important to briefly review how normal sexual function occurs. Sexual response involves a complex interaction between the brain, spinal cord, peripheral nerves, blood vessels, hormones, and psychological factors. Sexual desire, or libido, is largely driven by the brain and is influenced by neurotransmitters such as dopamine and norepinephrine, as well as hormones like testosterone and estrogen. Sexual arousal involves increased blood flow to the genital tissues, mediated by nitric oxide and parasympathetic nervous system activity. Orgasm and ejaculation are coordinated reflexes that depend on precise signaling within the spinal cord and brain. Any disruption in these systems, whether neurological, vascular, hormonal, or psychological, can result in sexual dysfunction. Antidepressant medications primarily interfere with neurotransmitter balance in the brain, which explains why their effects on sexual function can be so profound. Mechanism: how antidepressants cause sexual dysfunction. Most commonly prescribed antidepressants work by altering levels of serotonin in the brain. Serotonin is an important neurotransmitter involved in mood regulation, emotional stability, and impulse control. Increasing serotonin levels can significantly improve symptoms of depression and anxiety. However, serotonin also has an inhibitory effect on sexual function. Excess serotonin suppresses dopamine, the neurotransmitter most closely associated with pleasure, motivation, and sexual desire. When dopamine signaling is reduced, libido decreases and sexual motivation declines. Serotonin also interferes with spinal reflexes involved in erection, lubrication, orgasm, and ejaculation. Additionally, increased serotonin reduces genital blood flow and sensory perception, leading to decreased arousal and mute dogamic sensation. The result is a constellation of symptoms collectively referred to as antidepressant-induced sexual dysfunction. These effects are dose-dependent and vary between individuals, but they are not imaginary, psychological, or a sign of personal weakness. Antidepressant classes and sexual side effect risk selective serotonin reuptake inhibitors, or SSRIs, are the most commonly prescribed antidepressants. Examples include fluoxetine, sertraline, escitalopram, citalopram, and paroxetine. Among these, paroxetine is associated with the highest rate of sexual side effects. Studies estimate that between 40 and 70% of patients taking SSRIs experience some form of sexual dysfunction. Serotonin norepinephrine reuptake inhibitors, or SNRIs, such as venlafaxine and duloxetine, also commonly cause sexual side effects, although the severity may vary. These medications increase both serotonin and norepinephrine, but the serotonergic effect remains dominant with respect to sexual function. Atypical antidepressants such as bupropion and mirtazapine tend to have a lower risk of sexual dysfunction. Bupropion, which primarily affects dopamine and norepinephrine, is often used as an alternative or adjunct therapy for patients who experience sexual side effects with SSRIs. Sexual side effects in men. Some men also report reduced intensity of orgasm or a feeling of emotional and physical detachment during sexual activity. Erectile dysfunction occurs because serotonin interferes with nitric oxide signaling and parasympathetic nerve activity required for penile blood flow. Men may notice fewer spontaneous erections, including morning erections, which can be particularly distressing. Delayed ejaculation is a very common SSRI effect and is sometimes severe enough to make into recourse unsatisfying or impossible. These symptoms can lead to performance anxiety, avoidance of intimacy, and strain in relationships. But these effects are often underreported and underrecognized. Common symptoms include decreased sexual desire, difficulty becoming aroused, reduced genital sensation, vaginal dryness, pain during intercourse, and difficulty or inability to achieve orgasm. Serotonin reduces genital blood flow and lubrication, which explains many of these symptoms. Women may feel emotionally interested in intimacy but physically unresponsive, leading to frustration and confusion. Over time, this mismatch can reduce sexual confidence and contribute to avoidance of intimacy. It is important for women to know that these symptoms are not a normal or inevitable part of aging or depression. They are medical side effects that can and should be addressed. While PSSD is uncommon, it is a recognized condition that requires careful evaluation by sexual medicine specialists. Ongoing research is exploring the underlying mechanisms and optimal treatment strategies. Management and treatment options. The most important rule in managing antidepressant-related sexual dysfunction is never to stop medication abruptly without medical supervision. Sudden discontinuation can cause withdrawal symptoms, emotional instability, and relapse of depression or anxiety. Management options include dose reduction, switching to a medication with fewer sexual side effects, or adding another medication such as bupropion to counteract serotonergic inhibition for men with erectile dysfunction. Phosphodiesterase type 5 inhibitors such as sildenafil or tadalafil are often highly effective. For women experiencing vaginal dryness or pain, particularly when medication effect shave led to anxiety, avoidance, or relationship distress. Lifestyle and supportive measures. Lifestyle factors significantly influence sexual health. Regular physical activity improves blood flow, hormone balance, and mood. Adequate sleep is essential for testosterone production and overall sexual function. Limiting alcohol intake, managing stress, and maintaining balanced diet all contribute to better sexual outcomes. Open communication with partners and healthcare providers is equally important. Sexual side effects should be addressed early rather than tolerated in silence. When TO seeks specialist care if sexual symptoms persist for more than several weeks, worsen over time, or significantly affect quality of life or relationships, consultation with a urologist or sexual health specialist is strongly recommended. Specialized care can make a substantial difference in outcomes. Conclusion: antidepressants are powerful and often life-saving medications, but their sexual side effects should never be ignored or minimized. In the vast majority of cases, these effects are manageable and reversible with the right medical approach. Patients should never feel forced to choose between mental health and sexual health. Both are essential components of a healthy, fulfilling life. Disclaimer: this document is intended for educational purposes only and does not replace personalized medical advice. Always consult your healthcare provider before making changes to your medication or treatment plan. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss an update. We've got plenty more real talk on men's health coming your way. Thanks for watching, and we'll see you in the next video.